Hi, I'm Heidi Waldock, licensed marriage and family therapist and owner of Bridging Hope Counseling. We are located in Rogers, Lino Lakes, and Buffalo, Minnesota. Today, I'm going to be talking about what happens in therapy. I want to thank you all for liking our videos, subscribing to our YouTube channel, and want to encourage you to do that if you have not done that. And the YouTube channel that we started, when you subscribe, make sure to click the bell so that you can get notifications on any new video that we are uploading. We really appreciate your support, the comments and the likes that you have on our page. We really are wanting to communicate just the normalness of mental health in the community, especially with the things that we see happening locally. One of our offices that we have there has definitely been a significant amount of suicides in the community. And so this is actually one of the reasons why I'm doing these videos, is to help communicate that we can all go to counseling. And I myself am one of them, and trying to decrease the scariness of counseling and talk about this and help this to be more real. So just want to encourage you to share these videos, like I said, and make sure to subscribe to it. So we appreciate your support. So today, like I said, I'm going to be talking about what happens in counseling. So I had a friend, actually I have many friends, I have many people that I'll talk to that will say, oh, do you have a name, or do you know this person, or I'm looking for a counselor here. And so I'm always giving people names, and sometimes they call, sometimes they don't, and sometimes they come back. And I had one particular friend that a year ago she had asked me, and so I gave her some names, and I don't think she went yet. And so six months later she asked me again, and then she went. So it took her a while to go. And you know, when she was more serious about going, it was really because the situation got worse, unfortunately. That is sometimes what happens. And when we actually go, when she thought about going to counseling, honestly, she said she was afraid to reveal herself. She was afraid to reveal any dirty secrets and any dirty laundry. She was afraid to be judged and to really get to what the real problem was. She honestly felt like she was doing everything right, and she didn't want someone to tell her that she was doing something wrong. But what if she wasn't willing to accept that and not go get help? So coming to therapy really can, I gotta be honest, it can be intimidating, it can be scary, it can be overwhelming. Many people actually grow up thinking that therapy is for crazy people or for people who have issues. It's for those people over there. It's not for you, it's not for me. Or we might wonder, okay, so why can't I get through this on my own, okay? Is there something wrong with me? What will actually happen in therapy? So these are just kind of some of the things that we think about and that we wonder. So my friend, she did finally make the appointment, and she did finally come in. And so here's what she said after she went. After the first 5 minutes, I felt safe. The atmosphere felt safe. The office was like a friend's cozy living room. For me, the hardest part was making the appointment and walking through the door. I had to get over my ego and get over my perception of myself. Yes, we are not perfect, and it's okay. It was a freeing feeling. Whatever happens is going to make the situation better, no matter what they tell me. Wow, this is so honest. I was so grateful that she shared this. And really what she shared is very common. She was comfortable sharing this because she knew that it would help other people. She knows her story is typical. When we think about coming in, we know it might be good for us to go, but sometimes fear can stop us, some other things. We might have some preconceived notion about therapy and so we don't believe it will help us. We don't think it's going to help. I do have another friend that I was asking just last week, and I asked him honestly, I said, why haven't you gone to therapy? This is somebody I've encouraged to go. And he honestly was like, I don't know. Like he really didn't know. And so I was able to kind of ask and dig a little, and he said, well, I'm happy, I'm good. You know, like he's like thinking there's not really a reason why he needs to go. And I just kind of, reminded them, those choices that you made, remember those? And he was like, yeah. He kind of remembered, and he's like, I think I'm kind of stubborn. And he was able to really be honest to share that he's stubborn. And I think that's also why my friend was, she was thinking she's doing everything right. So we think we don't want to go in and someone's going to tell us we're doing something wrong. And so I was grateful for him to share that too. And hoping that he will also make the leap and go himself. So also I think another reason why is we don't have therapists around us. Like, because he's my friend and I'm a therapist, I'm going to encourage him and say, I think you should go. If we don't have people around us that are that are therapists or that know someone, you just might not be on your radar. So here I am, I'm on your radar. I hope you're watching this video and you share this with people, so I'm on your radar now. All right, so I'm going to give you 5 things that actually happen in therapy, like what you'd expect and what actually really happens. And I'm going to do my best here. If there is anyone that's watching, I appreciate you guys for watching, that you have questions, feel free to ask them. As long as they're not too hard for me to answer, I will try to do my best. Each video I do, I get a little more comfortable. So I appreciate the support that you guys have given me. So number 1 is before the first appointment. Every single agency is different. We ourselves at Bridging Hope Counseling, we have an intake coordinator. So we have somebody who answers the phone that you will be able to get a live person when you call. So you schedule the appointment. She's going to ask you for basic information. So like name, address, phone number, date of birth, insurance information, and then the basic reason why you're coming. She does not need to know deep details unless you really want to make sure that you have the right therapist. She might ask a few more questions. And like you might share, I've just been really struggling with being in the blues. I'm down in a hole. I need to help somebody to get me out of this hole. You might have a child that is struggling with suicidal thoughts and you want to come in for family counseling and hopefully individual counseling. Sometimes you have to start with family, or sometimes you start with yourself and you hope somebody else comes in. You can share that you want some couples counseling because you and your spouse aren't getting along very well and you want to improve communication skills. So there's many different things why you are going to counseling and why you come in. I know that some other agencies, you might not get a live person. You leave a message, they might call you back. Like I said, every place is different. So for us, there's a law that was passed a few years ago about electronic health records. So everything that, anytime somebody schedules an appointment with us, we will then send them an email so that they set up an online portal. A lot of times when you go to the doctor's office, this is the same thing. This is like that with us. So you get an email, you set up a portal, and you will answer questions through this portal that will be confidential, and it goes straight to the therapist that you're going to meet with. Some of the questions are on like depression symptoms, anxiety, different things that you're struggling with, and kind of some basic medical and mental health questions. Have you gone to counseling before? Things like that. Everything's confidential. Nobody else gets it except for the therapist. And then, so you will have time that you'll be able to complete those questions before the appointment, and then you have the appointment with the therapist. Then you meet with your therapist. So that's the second one, which is the first appointment. What happens there? So at this first appointment, you're going to meet with your therapist. You will fill out some basic paperwork. Like I said, every agency is different. With us, we kind of have some basic intake paperwork. We want to make sure that you understand confidentiality, that everything's confidential. We talk about some basic ethics, scheduling details, because once you meet with the therapist, you then schedule ongoing with them. Other places you will schedule with a receptionist. We're a little bit different. And so that's how we work. Sometimes it's nice to be able to hear, oh, they all kind of work a little differently. We don't actually have a receptionist in the lobby. We have one at our main office that you schedule with. And so then the therapist will ask you questions like what it is that you're looking for, what are some of the symptoms, how long you've struggled with the symptoms, even just some things like what do you do for work, what are the things that you like to do, and ask some basic information about your family. So here's a question that I will ask people. So like if you were coming to therapy and you're my client and you sat down and we filled out all the paperwork, I would say, here's the question I would ask you. I'd say, so if you were to wave a magic wand and everything would be exactly like how you wanted it to be, what would that look like for you? So that's a question that I would ask. And like I said, different therapists ask different questions, but this allows you to paint the picture of what you want it to be instead of always just focusing on these are the problems. Because a lot of times we focus on what the problems are instead of what it is that we're looking for. And so I like being able to do that as a therapist. And so let's see here, some other things. You basically are going to be heard. You're going to be able to spew out everything that's going on. And that's one of the things that feels really, really good, is that you're able to share your story. You're able to be heard and say everything that's going on. Some other kind of basic things are accepting payment. So if you need to make a co-payment or co-insurance or pay for the session if you're not using your insurance, it's the same things if you're going to the doctor. All right, so everything's very similar with that. And so number 3 is safety and connection to your therapist. Out of this whole video, I would say this is the most important thing. because you need to feel safe. You are coming in and you are spilling out detailed, intimate information. If you don't feel safe with the therapist, then it's not going to be effective, okay? Here's what I would say. Ask them questions. If you have questions, don't hesitate. Just ask, all right? The research shows that the relationship between client and therapist is essential in the success of therapy. All right? So think about this. Like when you're connecting with certain friends, like what makes you trust them? Okay? The ones that you feel safe with, the ones that don't judge you, the ones that keep your secrets, the ones that do what they say and who are kind. Okay, you want that in a therapist, all right? I know that they're not in your life, but it's important that you feel safe with them. You want to make sure that you feel heard and that you feel seen. Okay, Dr. Robert Firestone is quoted saying, "Above all, the therapist must remain authentic or remain an authentic human being with genuine feelings." Folks, we are real people. Yes, we have letters behind our name, but that is not what makes the connection in therapy, and that's not what produces shift and change with the clients. So feeling safe is one of the most important pieces. And I'll always encourage people, if you meet someone and it doesn't feel like a connection, that's okay. Find somebody else that you trust and that you feel safe with, because this is what can shift breakthrough. And number 4 is length and time. Therapy appointments can vary with different agencies. Our sessions are typically 45 to 53 minutes long. The frequency and duration of the sessions can depend on each client. Some people will come for 3 to 4 months. Some people go for 6 months or even a year. It's longer sometimes with couples and families because the different dynamics and meeting with different people. And then also if there's more deep difficulties and trauma, either from childhood or from past relationships, that can take a lot longer. And when there's trust issues, that means it's going to take longer to trust the therapist. Because if you don't trust the therapist, then you're not being authentic and you're having a hard time being yourself there. It takes longer, and that's okay. All right, that is totally fine. I have clients that I've worked with for years, and that's what we needed that for the breakthrough. There are times when you start out with therapy, it's weekly a lot of times, and then there are times where you might move maybe twice a week at first. It just depends on the situation, and then sometimes clients will move to every other week or even monthly check-ins. Okay, I'm going to tell you that going once is not therapy. I'm going to be a little dramatic here, but I will have people that'll say, "Oh yeah, we tried therapy, it didn't work." I'll say, "Oh, that's great. How long did you go for? Where did you go?" They went one time. You can't just go one time. You need to go, I'd say at least 4 to 5 times, because then you can at least get somewhat of a connection and have homework and come back and try something and to see if something was actually helpful. Okay, and I hesitate to kind of share this length and time, and because it's different with every single person. I don't want you to think therapy does not fit in a little box. It's different with everyone. All right, so number 5 is ending therapy. Again, this is very different with each person, but typically when you're using a lot of the tools that you were given, you don't have as much to talk about, and you feel more like yourself, you feel more confident, you will know when therapy isn't needed anymore. Most therapists have treatment goals that you can work towards, and success can be measured when you've achieved these. So for example, a goal could be decrease depression, increase self-esteem. Okay, utilize 5 to 10 communication skills on a weekly basis. Those are just kind of some examples. I would say that it's really nice to find a trusted therapist that you can go back to during different times of your life. So it could be maybe you're having some relationship difficulties where you didn't before and now you do. So you kind of check in about that. Maybe there's some extended family dysfunction that's happening, and so you need an outside person to talk about it. Maybe one of your kids is struggling with some negative thoughts, and so you want to bring them in for them to see someone and maybe do some family work. So it's nice to have someone and just kind of check in during different seasons and times of your life. It's okay to come back and get this outside advice. I've gone a year before I've came back and checked in, and my therapist is like, "Oh, it's so great to see you again." I'm thinking, "Oh, great, I'm good to see you too." So it just depends, but then there are times where I'll go weekly because I feel like I need it. And especially us as therapists, we're seeing a lot, and so it's important for us to be able to know, okay, something's showing up for me, I'm getting triggered from this. We've got to be able to have consultation and our own personal therapy that we can go to. So going to therapy doesn't need to be scary, and it can be freeing, like my friend explained. Our family and friends can only support us so much, and they can only hear our stories and only hear everything that we have going on for so long, okay? And sometimes an outside therapist is exactly what we need for breakthrough and moving over some humps that we really need to move past. You are not nuts. You are not crazy. It is normal, and I want to I want people to feel more comfortable with seeing that it's normal to go to counseling. Honestly, if you're struggling with depression, anxiety, whether even it's stress, whether it's work stress or home stress, or even just personal stress, if you're feeling kind of down in the dumps, general unhappiness, if there's some sort of addiction, whether it's alcohol or porn or gambling, or even just some other addiction where you're putting your time into something, get some help. Like, find and schedule a counseling appointment, whether it's with us at Bridging Hope Counseling or some other agency. It doesn't matter to me. Just getting that outside help is important. Get the help that you need. And here's what I would say for parents who have younger kids who are struggling. When you get counseling and they see you're getting it, they then see, oh, that's not a big deal. Mom and dad go, oh, I can do that too. And so you're modeling to them that it's something that is normal, just like going to the gym or going to the regular doctor's appointment, that it's just another appointment. And so we want to have it be we don't want it to be a big deal. And so us as parents can start that by doing it and talking about it and having it be part of a conversation. So really, it is brave, though, to take that first step. It's one of those things that after you do it, you wonder, what took me so long? Thank you so much for listening, and have a wonderful day.